Hello and welcome to my channel. Today we're going to tackle a subject that might surprise you or even shock you. I'm going to talk to you about 5 health screenings that seniors, particularly after the age of 70, should seriously consider avoiding. Yes, you heard that correctly, avoiding. Most of us grew up with the idea that the more health checkups we have, the better, that prevention is always synonymous with protection. But what if I told you that after a certain age, some of these screenings can actually put your life in danger? It may seem counterintuitive, yet it's a reality that more and more doctors are beginning to acknowledge. All screening tests are not harmless. In fact, some of the most commonly offered checkups for older people can lead to false alarms, unnecessary stress, and even dangerous procedures that end up causing more harm than good. This isn't an attempt to alarm anyone. It is a medical truth that we must face, especially when we are talking about patients over 70 years old. The medical world is opening its eyes to a new reality. Uniform screenings, designed with a one size fits all approach, can do more harm than good as we get older. Our bodies change, our priorities evolve, and our ability to withstand certain interventions decreases. Yet, the medical system often continues to apply the same protocols regardless of the patient's age. In this video, we're going to take an honest look at 5 specific health screenings that seniors should seriously consider avoiding, screenings that many experienced doctors, ironically, refuse to undergo themselves once they reach a certain age. We will see why these tests are so frequently offered, what hidden dangers they carry, and what safer alternatives exist to stay informed about your health without putting yourself in danger. You deserve medical care that respects your age, your body, and your quality of life. If you care about your health but don't want to suffer from overtreatment, excess medication, or unnecessary stress imposed by the current healthcare system, then this video is for you. Stay with me because what you are about to learn could literally save your life. Before we start, consider subscribing and activating the bell so you don't miss any future health tips specially designed for you. If you appreciate this video, type 1 in the comments. Otherwise, type 0 to tell me how I can improve. Let's get started. 1. The colonoscopy trap. Let's start by talking about the colonoscopy. This exam that has long been considered the absolute gold standard for preventing colon cancer. For decades, doctors have recommended it almost systematically starting at age 50 and then every 10 years. It has become a medical ritual, almost a rite of passage in adult life. But here's what they don't always tell you. After 70, especially for people with no symptoms or family history, this exam can quietly become more dangerous than useful. What was a potentially life-saving screening in your 50s or 60s can, after a certain age, lead to stress, complications, or even an emergency hospitalization. Why this transformation? Because a colonoscopy is not a harmless procedure, contrary to what we are sometimes led to believe. It requires a complete bowel preparation that can last for several days. This purging phase, which is already taxing for a healthy adult, becomes much riskier with age. The elderly are particularly vulnerable to the dehydration and electrolyte imbalances that this intensive preparation can cause. We're talking about complications here that can be fatal: heart rhythm disorders, a sudden drop in blood pressure, mental confusion. Then there's the sedation. Anesthetics stay in the systems of seniors longer as their metabolism is slower. This can cause prolonged confusion, persistent dizziness, and increased risks of falling in the days following the exam. I have seen patients who were perfectly independent before their colonoscopy end up hospitalized after a fall caused by the residual effects of sedation. But there is something even more concerning, and this is where we get to the heart of the problem. Many older people, particularly after 75, subsequently undergo completely unnecessary treatments or procedures after a benign polyp has been discovered. These small abnormalities, these growths that almost all of us develop as we age, sometimes take 10 to 15 years to develop into cancer, if they ever do. Think about it for a moment. For a person aged 75 or 80, this potential 10 to 15-year evolution may never become a real problem. Statistically, this person is much more likely to die of something else long before this polyp becomes problematic. Yet, its discovery immediately causes fear, anxiety, and triggers a whole series of medical actions. We are talking here about additional biopsies, more frequent repeat colonoscopies, or even partial removals of the colon in the name of prevention. But when the risks associated with the treatment far outweigh the real benefits for the patient, can we still call it prevention? Isn't it rather harm disguised as care? The geriatric medical community is, moreover, beginning to recognize this reality. More and more specialists are recommending stopping routine screening colonoscopies after age 75 or even 70 in some frail patients. There are now less invasive alternatives like fecal occult blood tests, which can provide useful information without the risks of an invasive procedure. Two, the mistake of the annual full body scan. Let's move on to the second trap that many seniors fall into, the annual full body scan. There's something deeply seductive about the idea of a full body scan. The thought that an ultra-modern machine can screen you from head to toe, detecting every hidden problem before it becomes serious. It sounds like smart prevention, like the medicine of the future, doesn't it? And yet, after 70, this approach can turn out to be far more dangerous than useful. Even if the intention behind body scans is laudable, the consequences they lead to often open the door to a cascade of fear, invasive tests, and even unnecessary surgeries that can shorten your life instead of prolonging it. Let's be clear about what we are talking about. Full body scans, whether they are MRIs or CT scans, are not classic screening tools validated by rigorous scientific studies. They are extremely powerful technologies capable of detecting absolutely everything, including and especially perfectly benign anomalies that would never, ever have affected your health or your life expectancy. These famous incidental findings, these incidentalomas as doctors call them, then become veritable mental time bombs. A small nodule here, a shadow there, an unusual density elsewhere. And there you are, unwillingly embarked on an endless series of medical appointments, biopsies, specialized tests, chasing after something that might never have caused the slightest problem. Imagine the situation. You walk into this imaging center in perfect health, you feel great, you have no symptoms. 2 hours later, you walk out with a list of abnormalities to monitor, specialists to consult, and additional tests to schedule. Your peaceful life has just been plunged into a state of permanent medical anxiety. Why is this even more concerning after 70? Because the body no longer reacts at all like it did at 45. A biopsy that was once considered harmless can now lead to a collapsed lung, a serious infection, or weeks of difficult recovery. The immune system of seniors takes longer to heal, to recover. Even the simple act of lying still for an hour for an MRI can become painful for aging joints and weakened muscles. And what about the contrast agents used in some scans? They can cause more severe allergic reactions in older people or worsen a pre-existing and often undiagnosed kidney failure. I have seen patients in apparently perfect health end up on dialysis after a scan with an injection. The reality is that our bodies naturally accumulate small anomalies as we age: cysts, nodules, calcifications, areas of different density. It's normal, it's the natural aging process, but the machines, they don't differentiate between what is normal for one's age and what is pathological. They detect everything without discernment. Three, the excess of cardiac stress tests. Let's now talk about the third trap, routine cardiac stress tests. For decades, the treadmill stress test has been considered a benchmark tool for detecting heart disease, especially in older adults. The reasoning seems logical. Make the heart work under pressure and observe its reaction. But after 70, this seemingly sensible reasoning can literally backfire on you. What was a potentially useful exam in one's 50s or early 60s becomes, after a certain age, a test that is not only questionable, but sometimes dangerous. Why this transformation? Because stress tests in the elderly very often yield what doctors call false positives. In other words, the results may suggest a serious heart problem when your heart is functioning perfectly well for your age. These misleading results are explained by the natural and inevitable changes linked to aging. Arteries naturally become stiffer with age, blood pressure tends to fluctuate more, the heart's electrical signals change without all of this necessarily meaning that there is an underlying disease. But here's the problem. The stress test itself doesn't make this subtle distinction. It doesn't understand the nuance of normal aging. It detects an anomaly compared to the norms established for younger hearts and immediately triggers a chain of follow up tests, angiography, cardiac catheterization, or even the placement of a stent or coronary bypass surgery. And all these procedures, all these interventions carry very real, very tangible risks. For seniors, these risks are absolutely not trivial. We are talking about sometimes uncontrollable bleeding, serious kidney damage due to contrast agents, sudden drops in blood pressure, and post operative infections. Cardiac interventions become exponentially harder to bear with age, and complications multiply dramatically. I have seen 75-year-old patients in excellent physical shape, able to do their shopping, garden, and play with their grandchildren, find themselves permanently diminished after a cardiac procedure that was triggered by a misinterpreted stress test. Their quality of life, their autonomy, their joy of living, all had been sacrificed on the altar of misunderstood prevention. Today, many experienced cardiologists and most geriatric associations formally recommend avoiding routine stress tests in older adults without symptoms. They are unanimous on one crucial point. If you have no chest pain, no abnormal shortness of breath, and no unexplained fatigue, then there is often no real benefit to having this test, but there is a very concrete risk. The logic is simple. Why go looking for problems that may not exist at the risk of creating real ones? Why expose a heart that is working correctly to a cascade of potentially dangerous interventions? 4. Mammogram screening after 75. The fourth screening to seriously question is routine mammography after the age of 75. I know this topic is particularly sensitive, especially for women who have been conditioned for decades to have their annual mammogram religiously. But listen to me carefully, because recent scientific data is forcing us to reconsider this automatic approach. Breast cancer obviously remains a legitimate concern at any age. No one denies this reality, but what we are beginning to better understand is that mammogram screening after 75, particularly in women with no personal or family history, can lead to what is known as overdiagnosis and overtreatment. What does overdiagnosis mean? It means detecting cancers that would never have caused a problem in the patient's remaining lifetime. These very slow growing cancers, which are particularly common in older women, can take 15 to 20 years to become problematic. For an 80-year-old woman, statistically, there is a strong chance she will pass away from something else long before this cancer becomes threatening. But here is the tragedy. Once the cancer is detected, even if it is slow growing, even if it does not represent an immediate danger, the medical system kicks into gear. Surgery, chemotherapy, radiation therapy. All these treatments, already difficult for a young woman to endure, become exponentially more grueling and dangerous with age. I have accompanied women of 78, 80 years old who were living their retirement peacefully, traveling, enjoying their grandchildren, and who found themselves weakened, diminished, even bedridden after treatments for a cancer that probably would never have threatened their lives. Their life expectancy was not extended, it was shortened. Their quality of life was destroyed. Mammograms themselves become more difficult to interpret with age. The breasts age, tissues change, benign calcifications multiply. This considerably increases the rate of false positives, those results that suggest a problem when there isn't one. And every false positive triggers additional tests, biopsies, stress, and anxiety. More and more oncologists now recommend individualizing the decision for mammogram screening after age 75. They take into account the patient's overall health, her probable life expectancy, and her other health issues before recommending whether or not to continue screening. 5. Repeated lipid panels. The fifth and final trap I want to talk to you about concerns repeated lipid panels and aggressive cholesterol treatments in seniors. For years, we have been conditioned to believe that cholesterol was public enemy number one, that it had to be tracked relentlessly and kept at lower and lower levels, regardless of age. This approach, which might make sense for adults age 40 or 50 with decades of life ahead of them, becomes much more questionable after 75. Why? Because the relationship between cholesterol and cardiovascular mortality literally reverses with age. Recent studies have shown that in the very elderly, having slightly elevated cholesterol may actually be protective. Cholesterol plays important roles in the body. It contributes to hormone production, brain function, and maintaining the integrity of cell membranes. In an older person, cholesterol that is too low can be associated with increased frailty, cognitive impairment, and higher mortality. But the real problem is statins, the cholesterol lowering drugs prescribed en masse to seniors. These medications, already debatable in younger people without a history of cardiovascular disease, become frankly problematic after age 75. The side effects multiply. Muscle pain that can become disabling, chronic fatigue, memory problems, increased risk of diabetes. I have seen dynamic, independent seniors completely lose their mobility due to muscle pain caused by statins. People who were still hiking at 78 found themselves unable to climb the stairs after a few months of treatment. Their cholesterol had dropped, certainly, but at the cost of their quality of life and their autonomy. The most ironic part is that for these very elderly individuals, the cardiovascular benefit of statins is often marginal, if not non existent. Studies show that in people over 75 without a history of heart disease, statins do not significantly prolong life, but they can considerably degrade it. 6. Aging. Well, a matter of discernment. So, what should we take away from all this? What should you do in concrete terms? First, understand that I am not encouraging you to neglect your health or to blindly reject all medical follow up. That would be irresponsible and dangerous. What I am encouraging you to do is to develop your discernment, to ask the right questions, and to no longer passively accept everything that is offered to you in the name of prevention. There is something very reassuring in the idea of multiplying screenings, of regularly checking every organ, every function. It gives us the illusion of controlling our health, of mastering the aging process. But this is where wisdom must intervene. Aging well isn't about chasing after every hypothetical problem. It's not about turning your life into a permanent medical journey. Aging well is about learning to listen to your body, preserving your autonomy, and avoiding unnecessary interventions that take more than they give. It's understanding that sometimes not knowing can be preferable to knowing something you can't change without major risk. This absolutely does not mean you should neglect your health, quite the contrary. But instead of running from one test to another, focus on the fundamentals that have proven their worth. Walking every day, maintaining a balanced diet, staying socially active, managing your stress, getting enough sleep. It is these actions, these simple habits that truly support your health after 70. What we need at this age is discernment, the courage to say no, even when it's your doctor suggesting it, and the wisdom to understand that a test is not always a gift. Refusing a test is not giving up on living. Sometimes it is the greatest proof of respect for your own life. Aging doesn't mean becoming powerless in the face of the medical system. Quite the contrary, it's often at this time that one becomes wise enough to question the automatic routines, to slow down and ask this simple but fundamental question: is this really useful for me at my age, in my particular situation? In a medical world that glorifies always more tests, more checkups, more drugs, sometimes the bravest and most intelligent choice is to do less. Not out of negligence or denial, but out of a deep understanding of your body, your values, and your true priorities. At this stage of life, your health should not be a chain of automatic tests or impersonal protocols applied blindly. It should be the result of an open discussion with professionals who respect you, of a personal reflection on what truly matters to you, on how you want to live your final decades, and on the risks you are truly willing to take. Feel free to share this video with your loved ones, your senior friends, because this information could literally save their lives. And you, tell me in the comments, have you ever experienced a situation where a medical test created more problems than it solved? Your story could help others make the right choices. Take care of yourselves and above all, make the right decisions for your health.